So today I wanted to talk about, at this session, just building our community table. I often have serious talks, and I felt like community is more about connecting and unity and communication, and also all the sub-communities under the umbrella of the fibromyalgia community, and kind of basically breaking those silos and bringing everyone to the table. So with community, there is connection and validation and support and information and education. But there's also some underlining things with a community that we're not, I don't think, fully realizing we're accomplishing, because as a community, we've been hitting the ground running, trying to address a lot of the inequities and do some legislative advocacy and healthcare policy advocacy that we sometimes forget to check in with our community, but mostly with ourselves, because we often, as a community and as individuals, we often hold on to our failures and disappointments too tightly, and we forget our successes and our triumphs too soon. Does that make sense? So one of the things, in order to celebrate our successes and in order to be more cohesive, is we need a community table. So one of the things is, a lot of times I hear from advocates and patients and caregivers and even medical providers and researchers, is that we need someone to invite us to the table so that we can start emoting changes in a positive direction, move that needle to help the fibromyalgia community. You know what? I'm not about being invited. I'm going to build my own doggone table. So that is what we've been seeing happening within our community, especially in the past 5 years. We as a community said, you know what? We need support, and we're going to bring it for ourselves. We need a table, so we're going to build that table. And at that table, everyone is invited. Everyone with fibromyalgia, everyone with coexisting medical conditions, caregivers, medical providers, researchers, politicians. So we need to focus on ourselves and stop thinking and wanting and worrying about other people opening those metaphorical doors. Because quite frankly, I don't need anybody to open the door. I'll kick it open, or I'll find a window to go into. The other thing is, we have the tools and the skill sets to build our own table. So I think of, if you're familiar with family dining or communal dining, is you have this long table, holidays. I know in my family, during the holidays, when we would have everyone over, we're looking at 40 people at the table. So I look at our community as a table. And as we expand, as we grow, as we accomplish things, we add more to our table. Within that, just so you know, I might have some cameo appearances happening here with my furry fibro friends here. My dogs are going a little nuts. They decided to get the zoomies. But they are dressed and prepped and wearing purple today. So going back to the table, one of the things about the table is we have to be cognizant and aware of all the sub-communities within our community and give them equal access. So what I mean by this is, we often say, or we hear, or we read that fibromyalgia is predominantly a woman's illness, right? So what about all of our male warriors out there? When I delved deeply into research from late 90s through the mid 2000s, I found some research studies throughout the world that was looking at the prevalence of fibromyalgia in men. And statistically, across all those fibromyalgia surveys that were looking at the prevalence of how many men had fibromyalgia, it's projected 37 to 42% of fibromyalgia sufferers are actually men. We often forget that. And I even see it in comments and blogs, or even on the internet, or doctors saying it's mostly a woman's illness. Our job as a community is to break all the stigmas with fibromyalgia, including the stigmas associated with our sub-communities within our community. And we need to make sure we're leaving ample space for men. living with fibromyalgia. Another statistic that we often don't talk about within our community is that research done in like Denmark and the US and Mexico has found that 1% to 2% of fibromyalgia sufferers are children and adolescents. So we need to make space for them too, and their caregivers. The other thing is we often forget that when we're looking at our community, that a lot of us have coexisting conditions. So we see that prevalence shows within the fibromyalgia community percentages that about 25 to 30% of people living with lupus also are diagnosed with fibromyalgia. So we need to make sure that not only are we giving them space, but we're understanding their unique needs living with both of these conditions. Same with men. We have to understand the archaic stereotypes that comes with having an illness as a man, and help men feel supported, heard, validated, giving them that space, but also breaking stereotypes that surrounds this sub-community of our community. Same thing with children. And then we look at one of the things that we often forget as an Army veteran living with fibromyalgia, we often forget that while we invite veterans to the table, we often forget that they're working in, some of us are walking two lines of healthcare within our community. So I call it hybrid healthcare. As a veteran, I go to some things for the VA and I go to private healthcare for other things. So I'm walking two lines of healthcare. And some things I see within our community that we are totally capable of addressing and alleviating is when we talk about fibromyalgia, when we advocate, when we promote awareness as a community, we often will say, okay, this is for fibromyalgia. And then we kind of step back and say, well, but that's a veteran issue with the VA. So how can I help? Right. And so now I'm going to kind of parlay this into what we can do in these different instances with our sub communities in order to strengthen our voice and break some of these silos and address inequities in healthcare. So as a veteran, I will often post on social media, like, here's this issue that's going, to Congress. Can you please, here's the link, email your congressional leader or your political leader or senator or state governor, whatever. And a lot of times with these sub-communities, we feel like, well, will my voice really matter because I'm not a veteran, or I don't have lupus, or I'm not male, I'm not a child, I'm not LGBTQ, but they are part of our community. So we have to be cognizant of their unique needs and supports. And so when we're looking at fibromyalgia as a community and we're sitting at our community table, we need to realize that everybody needs our voice. But also, we need to recognize that everybody has a valuable skill set to contribute. And we, as one person or one organization, we can't do everything. I know a lot of people think I do a lot of stuff, and I know I do, but there's a lot of stuff I don't do. And there's a lot of stuff, I'll be honest, I'm amazed that Melissa has coordinated this. I've coordinated conferences before in person. It's a lot of work. I could do it. I don't like it. So I don't feel like I would be as effective doing something if I'm not really liking, the procedure, the process of creating it. So one of the things with that is we need to understand as organizations, as patients, as caregivers, as friends, family, and people living with fibromyalgia, we all have a unique skill set that contributes to our success. And we need to make that space so that everybody's skill set can be on the table and we can all use that equally to push the needle in the right direction to bring about positive changes for the fibromyalgia community as a whole throughout all systems, all healthcare agencies, every country, every state, every city, every province, every region. And a lot of times when we look at our community, again, we seem to overlook warriors in other countries because we're like, well, their healthcare system is different, or the way their government runs is different than the US or different from Canada. And the thing of it is that we need to at least support those warriors in other countries so that they also have an equal stake in improving healthcare equity and systems in where they're living in their countries. So as a whole, as a community, we've seen this momentum building, especially over the last 5 years. I mean, fibromyalgia has become a household name. We're seeing more medical providers accepting this diagnosis and being more proactive with their patients with investigating ways to manage and treat symptoms. And moving forward, we've built this momentum where we've been bringing community members to the table and breaking that metaphorical bread and coming up with ideas, contributing our voices, contributing our skill sets. And with that, our community has seen a lot of effective changes in the past 5 to 10 years. I know it doesn't always feel like that because change, it's slow. I know it is. There's days I want to be like, I'm so tired. And I've been advocating in so many spaces for about 3 decades now. I'm 47. I've advocated in the space of childhood cancer, leukemia, intellectual disabilities and conditions, mental health, veteran, fibromyalgia, chronic pain. So I've been around the block a couple of times. And one of the things that has always helped me with initiatives or getting the word out is all of you, my community. We are stronger together. I see Eileen Davidson. Love you, girl. Eileen is an awesome advocate in Canada. But yes, we are stronger together. And I know it sounds cliche, but a lot of people don't realize how simple things such as sharing posts on social media, sharing your personal journey, which is your story, your book of life, and how your story can become someone else's survival guide. Reaching out to legislators or people in charge of, updating or initiating healthcare policy, these simple steps, whether it's on social media, you could tag these people. I do it all the time. I tag my senators, I tag my governor, I tag my congressional leaders. I have no shame. I don't care. But it's all these little simple steps. It's all these little things that we're doing as a community that has created this conversation. And people are starting to sit up and pay attention and realizing our worth. Why? Because we're telling them what our worth is. We're showing everyone that despite major funding, despite not having a major medical health system sponsoring us, supporting us, that we can do this in a grassroots way on our terms and be successful. And some examples is proclamations for fibromyalgia awareness. I saw in Canada's Faces of Fibro video how they were able to advocate to have a recognition week, Fibromyalgia Awareness Week in September, for fibromyalgia. We see fibromyalgia advocates who are creating connections, networks, and relationships so that they're presenting on bigger stages, whether it's about healthcare or medical technology. And all these little things up to legislative advocacy and moving the ball forward. And I know we say advocacy asks, but I call it advocacy tells. I tell my political leaders what our community needs and not things like funding for research, for specific driven research. As a community coming together for the last 3 or 4 years with this legislative advocacy initiatives where Melissa and the Support Fibromyalgia Network has been really leading the charge in that and bringing everybody to the table so that we can share our story and our skill set, we're starting to see the attention care that we need as a community. And part of that has come about is because we have created this community table and we've building and continue to build more chairs to bring everyone to the space and recognizing everyone's value, providing that support that they need, having everyone have equal and ample time to share their story and give their perspective living with fibromyalgia including some of the unique circumstances that might come with it. So as a veteran living with fibromyalgia, I'd have a unique experience trying to obtain healthcare through the VA, and then through private healthcare. Children and adolescents, their caregivers, guardians, parents, coming to the table and sharing their perspective as, a parent or guardian or caregiver taking care of someone underage with fibromyalgia, the unique needs of the LGBTQ community living with fibromyalgia and chronic pain. And all these little sub communities, while it might seem overwhelming to try to, basically learn and understand where they're coming from, we've simply just allowed them to share their story. And that's how we learn. And by sharing our story as a community and as individuals, that's how other people without fibromyalgia learn as well. And putting our face to fibromyalgia, it promotes the humanistic quality of a person that is actually living with a chronic illness. And because we've been doing all these things, because we are no longer afraid, because we have turned our disappointment into action, we are seeing the just care and attention and our needs slowly being addressed. And I'm not going to say we are at where we should be, because there is always room for improvement and we have a long way to go. This is a marathon, but you don't have to sprint the whole way. You can walk, you could crawl, you could take a nap, then start again. It's okay. It doesn't matter how you get to the finish line, just that you get there in your own way and in your own time. Moving forward as a community, we need to communicate more effectively with each other. We need to bring more people to our table, allow that safe space for everybody to share their story and their skill set to push initiatives, advocacy, and growth forward. But the biggest thing about our community is we need to be connecting with each other. And that includes connecting with each other in other countries, other areas, far from where we live, because I don't know, I'm an 80s kid, so maybe some of y'all will remember this, but do you guys remember Hands Across America or Hands Across the World through United Way? So what we would do is, like in elementary school, we would go out on a specific day and we would all hold hands as this crazy huge circle around the school, Hands Across America. And a show of unity of supporting the United Way, who supports children and all these other great things. And so we need to create our own metaphorical hands across the world and stand united as one voice, because together we make a difference. So in closing, I just want us all to think of this approach of community where we're building this family table where we can all sit, connect, support, promote, praise, lift up, share our skills, share our stories to emote positive changes for our community as a whole, but for us individually. So with that said, that's just my thoughts on building the community moving forward, and let's start expanding our table. And if anybody has any questions or anything or any comments in the comment section, and again, so I see Deborah, I hope you don't mind, I'm doing a shout out on you, but diagnosed with sarcoidosis, I always pronounce that wrong. I apologize. And fibromyalgia. And you have family members with lupus and fibromyalgia. And here's the thing. sarcoidosis is a rare condition, and not a lot of people understand it. And this is an opportunity where I do actually have a couple of friends with that medical condition, and I've learned from them. But not a lot of people would understand all the underlying things that is associated with that medical condition and how it compounds our fibromyalgia and kind of like this weird intersectionality that goes on between the conditions. So, having someone representing that community along with the fibromyalgia and sharing their story on the unique experiences they have managing both conditions, and then having family members with lupus and fibromyalgia, what we're doing is we're creating a multifaceted, personified example of what happens and where we're at when we're managing different things within fibromyalgia or multiple conditions, or having a chronic illness with family members with chronic illnesses as well. The dynamics change in that family. And so those are things and discussions we should have on top of all the advocacy and all the awareness initiatives, is highlighting that there is so many individuals in our community. I mean, like fibromyalgia, look, it's like Lay's potato chips. You just can't have one. It's like the whole doggone bag. So we all got multiple conditions that come with fibromyalgia and other chronic illnesses. Like we look at lupus and sarcoidosis and mental health, arthritis, rheumatoid arthritis, MS, PTSD. I could keep going. They all have their own symptoms. Then fibromyalgia has its own symptoms. Then there's paralleling or overlapping symptoms. And having all these conditions creates a unique experience that a lot of people won't understand. And by coming to the table, sharing our experiences so I can learn as well. I'm always open to learning. I love to learn and I want to understand. So we all come to the table with all of our stories so that we can learn about each other's unique needs. So moving forward as a community, when we're doing awareness initiatives, awareness campaigns, legislative advocacy, or, addressing healthcare inequities, we're able to represent all these variables within our community that affects us, but all these other things also strengthens us. Thank you, Karen. You're so sweet. So I hope that I didn't want to be too serious. I wanted to keep this particular talk a little bit light, just to make us think, to look inside our community, look inside ourselves, and how we're going to expand our table moving forward so that we are more representative of everyone's unique needs. And the other thing is, I want to say it is okay if you come to the table and you don't want to speak. Your presence is just as important as anything you can say. So you don't have to talk. You can just be, and we will hold space for you. And if you ever want to share your experience or collaborate, or you have an idea for an awareness campaign, reach out and include people. Talk to other individuals in other countries who speak different languages to come together, collaborate, and show how important it is not only to be a community and be recognized as a community, but moving forward, how cohesive we are as a community. Because I will tell you, over the years, I've heard many times, this can't be done for fibromyalgia. Legislative advocacy, awareness campaigns, funding, getting political leaders to understand our illness, or medical doctors. And I'll be honest, I just kind of laughed. I said, no, it can be done. We just might have to think outside of the box to do it. And our table is that metaphorical box. So with that said, I'm going to wrap up, and I hope you all enjoy the conference, that you learn, that you have fun, that you connect and build your social network and friendships and networking relationships on social media and on the internet.
Thank you so much, Kristal. Do you want to take a moment to go through some of the comments to say hello a little bit more?
Sure. And I have, but real quick, before we do that, I wanted to share. So a lot of you all well, not a lot of you all, but a few of you all might know that my dogs are very active in my fibromyalgia advocacy and awareness initiatives. And my dog Sydney has a bandana box, and there's probably 50 bandanas, and every Friday, we actually go in the box. It's bandana box day, and he picks out the bandana for the week. And I kid you not, he's got some intuition. Sid, you ready to show yourself off? You ready to show everybody what you picked today? All by yourself? Good. Come say hi. He picked his purple bandana today, this morning. So when I was after my coffee, we went to the bandana box and I took off his red bandana. I said, okay, pick one. And this was actually kind of buried at the bottom of the box, and he pulled it out. So then it would only be fitting to fit my other dog with the bandana as well. So one of the things about our community is we talk about all the individuals and people in it, but our furry friends, service animals, are part of that community too. And you can use them as part of your story or promoting awareness, or share how your pets have supported you with living with fibromyalgia, chronic pain, and other chronic conditions.
I love it. And we can find some videos too on social media with them, right? They're talking to us, they're dancing.
Mm-hmm. Yeah, Cody more than Sydney, because Cody's very egotistical, and he even had to tell everybody why he's important to have as a pet for your overall physical health and mental health. And he kind of dog cats a little bit. I can't be held accountable for what Cody says, but yeah, they've participated in a couple of Team Fibro videos, and bark on command when I say hashtag team. I'm not going to say it because they'll start howling and it'll be annoying. But yeah, so definitely include every aspect of your life with your story, your awareness and advocacy initiatives.
Well, we appreciate you. And there's more work ahead for advocacy, and we'll be updating everyone soon, right? We had some advocacy work continuing from our work these past couple of years doing virtual advocacy at Capitol Hill.
Yes.
So we're all working together. Kristal has been a force, and she has a lot of videos. So also on the Support Fibro YouTube channel, so Support Fibromyalgia, you'll find video interviews with Kristal and some of our special guests for our advocacy and action. We need additional people to join us as well. So we'll have signups, and we'll let people know in 2023, more action at Capitol Hill. So working with Kristal has been awesome. And then Kristal, you'll be up also back later on the stage, and then all the community sessions. Can you tell us a little bit about where we can find you throughout the conference?
Sure. So this evening at 9 p.m. ET time, which is 6 p.m. PST time. Do I get that right?
Yes. So 9 p.m. Eastern and 6 p.m. Yes.
Okay. So 9 p.m. ET time, which is night time for me, but I might put on my comfy slippers and PJs. But I'm actually going to be talking about patient healthcare rights and how to proactively advocate for your healthcare needs. And I have it all. Look, see, that's why I didn't want to be so serious with this conversation, because I'll have some kind of, important and pertinent information I'll be sharing that's a little bit more dry. So that is tonight at 9 p.m. ET time in my virtual booth, Veteran Voices for Fibromyalgia virtual booth at 11 a.m. ET time. I'm going to do Coffee Talk with Kristal. I used to do these on Facebook a lot for a couple of years, but Coffee Talk with Kristal is just a general session where you can come and connect, ask questions, tell your story, share your experiences in a safe space, so that you can also build your own community connection and networks as well. And then at 1 p.m. ET time tomorrow at my VVFF virtual booth, I will be presenting on how to strengthen your Veteran Affairs disability claim for fibromyalgia and what the VA looks at. And if you're not a veteran, you can totally jump in and listen, because I'm going to tie some points of applying for fibromyalgia through the VA for compensation, I'm going to tie some of those points and tips to applying for disability benefits as a whole. So, because some of the, practices and protocols that different systems use, there are some points that are similar. And a lot of it, again, is you're being self-focused and driving that ball forward for your own benefit and having an active part in putting that what you need together for your disability claims.
Fantastic. And I look forward to everybody connecting to you, as well as visiting your website, veteranvoicesforfibromyalgia.com. Please go visit. She has some great content and blogs and updates and all the work that she does with the veteran community over there. And then, of course, the Fibromyalgia Pain Chronicles on Facebook, and following you all on social media as well. And the reason why, too, that you're staying with us so late is because our very special friend, Carrie, who is chiming in from the comments, is joining us at 7 p.m. Pacific time, 10 p.m. Eastern, but it's actually 10 a.m. the following day. So it'll be 10 a.m. Saturday for Carrie in Taiwan. And here she is. She is a trailblazer. When we talk about advocacy, I just want people to know, can you imagine going to a new country and becoming an advocate for multiple chronic illness conditions? You can find her at myseveralworlds.com, and she'll be joining us later in the night. Please stay up. If you have insomnia like I do, we'll make it fun for everyone. We're going to chime in and have a party, and I can't guarantee that I'll even be able to go to sleep afterwards. So let's have a good time. Let's rally around Carrie. She has some giveaways from all our Fibro friends as well. We have giveaways throughout the day, so don't miss it later this evening. I think we're going to take a short break before Dr. Rutherford comes on the stage. We're running early. That's not normal for conferences, is it?
It's perfectly normal because we rock, because we are a community supporting each other and holding us accountable with being on time, but being ready ahead of time.
We were ready for this, and here she is. It's Carrie, the advocate from Taiwan, joining us again. She's just amazing. She was a Fibromyalgia Legacy Awards, and we'll bring in some of the awards later on. Totally getting my brain together, everyone. It was so early. It's still too early for me, and I need more coffee. And Estella will be back later in the day too, and we're going to learn from all of you. I love the comments from everyone around the world. This is going to be fantastic. And if you are available, please go check out those community sessions. Join with Kristal. And then also there's an international community session as well, where you can record and share your experience in the international scene. We're going to have a lot of advocates joining us. You're going to hear from Portugal. You're going to hear from India as well. So we would love if you're chiming in. I saw a bunch of people, Canada, Ireland, everywhere, Brazil. Please go into that community session. You're allowed to record a video. So just troubleshoot, set your audio and video up, look into the camera, and share your experience about living with fibromyalgia on the international setting. And we'd love to hear from you. And then we'll have these available in the replay if you'd like. Everything gets recorded in the community sessions, just to let you know. So please keep it family friendly. And again, keep looking out for any of those spam comments. And we'll be back soon on the main stage, Fibro stage. We'll make an announcement as we get Dr. Martin Rutherford on the stage. So see everyone shortly. Bye.